Hello. The first differential diagnosis that I chose for your post was endometriosis. The symptoms are painful menstrual cramps, heavy bleeding, irregular periods. This is a chronic disease that affects females between 20 and 40, but it can happen earlier. Some of them, is inflammation brought on by hormonal changes. The only way to really diagnose this is laparoscopy. Usually, for the pain, you could try like ibuprofen, Aleve to help with the pain. Some other hormonal therapies work, like birth control and different things to help control the pain. With the suppressing of the menstrual cycle. Even though you may have you have the surgery for it, symptoms may return within a few years. So you have to pretty much just use what's working for the pain and the things that help with the symptoms of this diagnosis, and to help relieve mostly it's the pain and the periods and the menstrual, that people have issues with. The second one is pelvic inflammatory disease, which is known as PID. It's an infection that occurs in the uterus, fallopian tubes, or the ovaries, usually by bacteria from an STD that typically cause it. Same kind of symptoms as your patient is abdominal pain, irregular periods, and heavy bleeding. Usually you have to be prompt with this because this can cause, with the treatment of antibiotics, this could cause infertility, and your partner should be tested and treated too. Usually you take antibiotics by 14 days, and then make sure you tell the patient to take all the medication even if they start feeling better. And this can be tested too by just a vaginal swab to find this out for the patient. So those are the two diagnosis differentials for the patient. But I think for your patient, I think I would pick endometriosis. That's the one that I picked that your patient may have.